to be doing is the stroking massage technique. So indications to do this technique are for acute or chronic pain. In this case, it's in his low back. So I'm just going to be stroking around this area, up and down strokes just like this, affecting more of the superficial tissues, not really affecting any of those deep tissues. It's a very gentle motion. Nice and slow, just like this. And how it's reducing pain is that it's applying a non-noxious stimuli. So it's those signals go through the A beta fibers. And what that does is as that signal travels, it inhibits any of the pain signals coming from those A delta fibers and C fibers, thus just gating the pain. So just these slow stroking motions in this area. It also helps get the patient a little bit more comfortable before we start any other massage techniques. So I just work with the area that I'm going to be doing massage with, and that's it. This next stroke that we're going to be doing is called ringing, and it's kind of similar to picking up, but it is moving the muscle a little bit differently. So what we're going to be doing here is we're just going to be picking up kind of just going. My hands go in the opposite direction. Kind of use my thumb to lead the way. And indications for this stroke are if there's any contractures in the area or any of the muscles, joints, ligaments, and so what we're doing here is we're breaking up some of those collagen fibers in the area and the connective tissue. So if there's any built up adhesions, this technique will help break it up a little bit. It's a little bit more aggressive, so it is affecting deeper tissues. And I would say that this massage technique is a little bit slower. It's not super fast, kind of a medium speed. So it's kind of like wringing out a towel when it's wet. And I'm not really using the tips of my fingers. I'm using more of my lumbricals, just so we don't want to hurt the patient in any way. And for the ringing technique, I do have him in a prone position, just so I can access this tricep muscle a little bit better. It's a little bit easier for me to work across the muscle just like this if he's in the prone position. Okay, so for the Effleurage technique, I have him in a sitting position, and I have his arm elevated here just so gravity can help us a little bit with the return of those fluids back into his system and towards his heart. So in this scenario, it's just general upper extremity. So let's say he has some swelling in his distal upper extremity. Indications to do this technique are if he has chronic edema in the area. So what I'm going to be doing is, since this is a generally smaller area than his lower extremity, I can just use one hand, and we're just going to be kind of applying some pressure and moving those fluids to his elbow and kind of holding it for a second, and then letting go and starting with the other hand. So I'm going about 7 inches per second and making sure to hold right here, just because there are sheds in the area that the fluid can go into and to go back into the system. So what this technique is doing is it's promoting venous return. So what we're doing is there's interstitial fluids that are causing that chronic edema, And with this technique, it's making those fluids a little bit more mobile. And it improves the circulation a little bit by getting a lot of that waste and sludge out of the area, just so that there's better blood flow, less waste in the area that can be blocking it. Okay, so once I kind of do this area for a little bit, there are some sheds that are in his armpit area. So then I'm going to work up here as well. So he has a bigger arm up here, a bigger part of his arm, so I can use both of my hands and use my thumbs to kind of move that fluid. And we're going to stop right at the top here. And then I'll let one hand go, and then I'll start again. But I'm just really focusing on making sure that I pause for a second up here just so that fluid can travel a little bit. And then I move. So you can just do this for a few minutes as well. Nice and slow,